we're going to use a completely different approach to recruiting patients that we've done in the past. In the past, the recruitment was all done by each site. Each site was responsible for identifying people and enrolling them into the study. Now we're going to work with the sites and help the sites with a very ambitious social media campaign, first of all. And the goal of the social media campaign will be to educate the population, to reduce mistrust about doing research, and to motivate and increase interest in participation in research. And then we will use digital advertising, largely using Facebook, to drive people to websites which are customized for each site and for race and ethnicity. So, for example, we have a site at the University of California in San Diego. There's a lot of Latinos and also quite a substantial African-American population in San Diego. So we're going to have a website. Of course, we'll have a website, an ordinary website for white people, but we'll have a separate website that will be aimed at Blacks, and we'll have another website that will be aimed at Latinos in English, and probably a website translated into Spanish, and then maybe a website for Asians. So we might have 4 or 5 websites just for the University of California, San Diego, so that when we do digital advertising in the San Diego area, there'll be, when people, if they're interested, they'll click here. And when they click there, that link will take them to the website that is linked to the ad that was placed for them. So we have 60 sites. So we're thinking we're going to have 4 or 5 or 6 websites for each site. So we're thinking we're going to have maybe 300-400 separate websites, each one locally branded. So when people come to that website, they'll think it's local. It's not a national study that they're being enrolled in. It's a local study with a local site. And that site will take them initially, if they appear to be qualified for the study, we're going to have them first have a blood test, most likely done at Quest, which is a company in the United States with many blood drawing centers, which are located in people's neighborhoods. We're going to have blood drawn, or maybe we'll have some people go to the homes of the participants also. So they'll have blood drawn, and then we'll measure the plasma for amyloid beta 42 or 40, or species of p-tau, or other AD biomarkers. We still haven't decided which biomarkers we're going to use for that. And then we're going to select people and encourage them to go to the sites. And we're going to give priority to people who are Black and Latinx. We're going to give priority to people who look like they got mild cognitive impairment or even dementia. And we're going to give priority to people who appear to be positive on Alzheimer's disease biomarkers, who look like they really have the disease. So that's a very brief summary of the overall approach we're going to use. I described this all more in my talk, and soon our grant is going to be put up on the website if people want to see more details. But that's what we hope to do. It's very aspirational. All of this really doesn't start until the fall. But we believe that this is really going to be the future for Alzheimer's disease clinical trials in many respects. First of all, there's a huge pressure to make clinical trials more inclusive. And we already see signs that some of the clinical trials will be doing that. So to do that, there's going to have to be more marketing aimed at bringing in people from the underrepresented populations into the clinical trials. And we think that a lot of that's going to be digital marketing, coupled with TV ads and other things that can be done. Secondly, using digital screeners is a low-cost, effective way to identify people who are symptomatic. And the digital screeners probably should include the ability to have study partners provide information into the digital screener, because friends and family, study partners can give a lot of valuable information about how somebody is functioning and whether their cognition has changed over the years. Then the next step is using blood tests as a screen, because the digital screener can identify symptoms and functioning, but the digital screener can't tell you whether or not somebody really has the disease. Only biomarkers can really identify the disease. And even here at ADPD, there's huge advances in the biomarker space, especially more recently, the measurements of various species of phosphorylated tau, p-tau 181, p-tau 217, p-tau 231 by immunoassay and also by mass spec assays. So there's a lot of companies that are developing various types of assays for this. It's competitive. It's very exciting. And everybody in the field agrees that these blood tests are going to be useful screens to identify people who have the disease who could then be enrolled in the clinical trial. So in other words, we think that the ADNI project is going to be a model for clinical trials of the future, and hopefully ultimately will lead to improved treatments and diagnostics, and ultimately the prevention of Alzheimer's disease.